20-year-old girl from Kaplan outside Mthatha in the Eastern Cape has developed a swollen abdomen after reportedly being forced to default on attending dialysis sessions 3 times a week due to an alleged lack of equipment at the Mthatha Regional Hospital. Newzroom Afrika's Ntsiki Nohiya is with the Democratic Nursing Organization of South Africa to talk more about the shortage of resources for patients on dialysis treatment. Good morning to you, Ntsiki. A very sad story coming from Mthatha this morning, but we certainly do know that unions such as DENOSA have only and always been advocating for resources to be given to nurses in order for them to be able to put forward their duties and their work, but in turn also for patients to be able to get the necessary help.
Indeed, Kat, good morning to you. When I had a chat with DENOSA, chairperson here in the province, before you called us, you were saying that this is a challenge for nurses as well, because having to witness or see the patient in front of you helpless yourself, you can't do anything to help that patient, and she is or he is hoping to get healed, and it is paining them. It is painful even to them. In the morning, I spoke to this 20-year-old woman from Kaplan outside Mthatha. She was telling me this heartbreaking story about defaulting on going for dialysis sessions 3 times a week as it was prescribed by the doctor. And she was not the only one here at this hospital. This is Mthatha Regional Hospital. That is where they are all housed from many different referral hospitals here in the former Transkei, and there are only 3 renal hospitals in the province. It's this one, Mthatha Regional Hospital, which gets all the equipment from Nelson Mandela Academic Hospital, Frey Hospital in East London, as well as Livingston Hospital in Port Elizabeth. But let me invite to this conversation the DENOSA, Democratic Nursing Organization of South Africa, chairperson here in the province, Sivuyile Mange. Mr. Mange, firstly, before we speak about a lack of resources in our hospitals in the province, what could be the repercussions of a patient who is not able to attend the sessions according to the prescription by the doctor?
First of all, this is worrisome and unfortunate, and it's concerning us as DENOSA in the Eastern Cape, because complication of this is death, which is not reversible. In an ideal situation, a patient is supposed at least to dialyze 3 times a week. But in this case, those days are to be reduced because of lack of resources, and these resources in this case are the consumables. It's not necessarily the machines, but the consumables, and that is due to budgetary constraints. And we've been raising this with the department for a very long time, the issue of budgetary constraints, and now that is why, as DENOSA in the Eastern Cape, we are very concerned about this situation.
She also spoke to me about the shortage of nurses, that they were unable to take in a certain number of patients as they were supposed to because of the shortage of nurses. And how is it working in an environment where there are no resources?
This is really a bad situation, because nurses themselves feel helpless, and yet they are the advocates of the patient, and they are the ones who are supposed to be ensuring that patient get the services, healthcare services that they need. But due to lack of resources, they become helpless. It is a result of this, what I've just said about the budgetary constraint. Hence, our call as DENOSA in the Eastern Cape is that at least Department of Health be exempted from the austerity measures that are implemented by the National Treasury.
Thank you so much, Sivuyile Mange, the chairperson of DENOSA here in the Eastern Cape, saying that they will not give up on engaging the department on these matters that affect the nursing, professionals across the province. And we are awaiting the response from the department as they are still collecting this information about this particular case. And not only this 20-year-old woman, a whole lot of them that have developed symptoms after they were not able, to attend dialysis 3 times a week as prescribed by their doctors. Back to you, Kat, in studio.
Well, certainly, Ntsiki, we hope that the highlighting of such issues will really speed up that process for government to be able to put in those very critical resources. That's Ntsiki Nohiya out in the Eastern Cape.